Has this been a bit of a gap in the market, if you like, that's been exposed by the pandemic?
No, this is actually a long-term plant to replace the current cell-based vaccine manufacturing plant that we already have with CSL. It replaces the egg-based plant, and it will be a cell-based. So the world is moving to new technologies. We wanted to keep ahead of the game and to lock in sovereign vaccine manufacturing capability in Australia, and with a long-term contract, CSL was in turn able to invest in a long-term plant that gives us coverage for the next 2 decades.
How concerned are you about this growing cluster in South Australia? We've just had the Chief Medical Officer in South Australia confirmed that there are now 17 cases related to that cluster. It was just 3 yesterday.
So this is obviously a matter of concern. We have stood up the National Incident Centre contact tracing capability. We have offered the Australian Defence Force capability, and any resources that are required will be provided. So as a consequence of that, we are confident that South Australia has an outstanding testing, contact tracing and isolation capability. But these are exactly the type of incidents for which Australia has been preparing. The Chief Scientist of Australia, Professor Alan Finkel, has done a review of the contact tracing, made recommendations for each state and territory, but also indicated that all of those systems are now strong, given that Victoria has lifted its system.
You say you've made a number of offers to South Australia. Have any of those been accepted?
Already the National Incident Centre capability has been accepted, and we use that centre, which is based out of Canberra, to assist with the contact tracing. South Australia is reviewing exactly their needs this morning, and they'll be back, no doubt, with any additional requests through the Premier as and when they're required and if they're required.
OK, well, more generally, the billion-dollar question seems to be, when will we get a vaccine and when will this start to be rolled out? And as a second part to that question, does the success of any vaccine rely largely on the rollout and the uptake of people accepting this vaccine? And do you need to do something to counter the misinformation messages by anti-vaxxers online?
Sure. So in terms of the first part, the when, our expectation is constantly being reaffirmed around a potential March rollout for our health workers and elderly subject to the approvals. That's seen new data from Pfizer, from AstraZeneca, from CSL, amongst others, come through in recent days and recent weeks. That has all been very positive. There'll be ups and downs on this journey globally, but our expectation is we will start in March, and that by the end of 2021, every Australian who seeks to be vaccinated will have been vaccinated. That's our clear goal and our expectation. Then in terms of uptake, Australians are great vaccinators. We've gone from 8 million flu doses a year just a few years ago to 11, then 13, and then this year, 17 million doses. We've also achieved record 5-year-old immunisation rates through the pandemic, now at 94.9%. And Australians are great vaccinators. So I'm confident that the noise of any anti-vaxxers will be dismissed by the vast bulk of Australia's population that has a strong trust in science and medicine.
Will you make it compulsory to an extent, for example, tying it to government payments like childcare, etc.?
There are no plans to do so at this stage. We've been very cautious not to rule those things out, and I'd rather be completely upfront about that. But we actually have no plans to do that at this point, and we'll continue to follow the medical advice. But the expectation is that there'll be a very high uptake. I'll be certainly making myself available to have the vaccine, and I know that Australians want to do the right thing by themselves and their family and by the country, and our history of vaccination both past and contemporary, is that Australians have high trust in the vaccination process. So as the anti-vaxxers have made more noise, they've had less impact. And that's, I think, the good news. And I do want to thank the Australian media, who have been incredibly strong supporters in elevating the importance of vaccination and, frankly, in shining a light on the myths of the anti-vaxxers.